Hi, my name is Emil Euaparadorn. I'm a physical therapist at the Aspire Center out of New York City, Manhattan. Today we'll be discussing how to loosen up your own kneecap. Right? I have this little pink disc here to represent the kneecap. The most important thing that many people may not be aware of is that whenever you move your knee back and forth, your kneecap goes up and down, side to side, and tilts. Right? So whenever you move, like whenever you bend your knee, it should go down. Whenever you straighten your knee, it should go up. It goes back and forth. If you don't have this motion here, you get this stuck feeling, and you start grinding on your thigh bone or your femur. And that causes something commonly referred to as patella mobilizations pain. And you usually get pain, really deep pain in the front of your knee. It's a pain that's like almost underneath the kneecap. You have pain with sitting for a long time, with stairs, and with squatting, and your knee will often make these clicking noises, cracking noises. So the key is that your physical therapist will tell you which of these 6 motions you need to work on the most. So the way to understand here is that when you loosen up your knee, you have to make sure your knee is straight. That way your muscles are relaxed. Okay, and you have to make sure that you actually grab the bone and move it back and forth. Don't try to push it over the skin and just give yourself a massage. So I'll demonstrate here on Dwayne. So Dwayne, can you scoot up so your heel is on the ground, your leg fully straight. I'm going to demonstrate here. The first one is like pushing it down. Okay. So this is Dwayne's kneecap, and I want to push this down. If I do this incorrectly, for example, I'm just moving his skin back and forth. But I have to grab that kneecap. So some people prefer using a thumb index finger approach. Some people prefer to use a web space, and they push it down like this. Alright, so Dwayne, can you do that for me? Okay. So he's using his web space here, and he's pushing straight down. Okay. When you use the thumb and index approach, here, and use the other hand as well. Alright, and you really can push down that way as well. Sometimes when you're doing this, you might have some pain, you feel some grinding. That's because when you try and push down, you're actually in a tilted position. So you have to fix that tilting. So the way you fix the tilting is very simple. You actually push down the side that's too up, and push it down. But sometimes when you do this, your kneecap will slip out of place. So you have to kind of hold the other side, then push down. So Dwayne will demonstrate here. Okay. So if Dwayne were to push over here, right, you see how this kneecap slips out of place. So you need to really stop that and then push. Okay? So that's very common. That's a medial tilt. And the final one is moving the kneecap side to side. That's pretty straightforward. Dwayne, can you demonstrate? All you do is grab the kneecap somehow, and then you push them side to side. Okay? A lot of times we have to go inward more rather than outward. Okay? A lot of times if you have a tight ITB, it will pull it upward too much. Okay? So one thing, if you have noticed, I did not mention how often you should do this, how much. It really depends on how bad your knee is doing. So what I like to tell people to do is to do a squat test. So can you stand up for me? Okay? And usually when your kneecap is in the wrong alignment, you have pain doing a squat. So for example, let's say Dwayne has pain with squatting, so squat. Now, ouch, I have pain right here. So okay, your kneecap is out of alignment. Sit down, do the kneecap stretch, right? Whatever position that your therapist tells you to do. You do for 30 seconds or for a minute, then stand up again, and then bend forward, and then squat down. And you should get better. Right? You should have at least 50 to 80% reduction of your symptoms, right? Especially if you know you're going to do a lot of stairs that day, or you're going to do a lot of running, stuff like that. Make sure your kneecap's in a good position. And in this way, you know what's going on versus trying and second guess it. So instead of using pain as a determination whether you should exercise or not, use a squat test. If it's out of whack, fix the kneecap and you'll feel fine, right? So please try this approach, and we'll be discussing more in other videos on what causes this.